Continuing on the serratus anterior muscle from the last video. So abduction, protraction draws medial border of the scapula away from the vertebrae. Goes up, upward rotation. The longer lower fibers tend to draw inferior angle of scapula farther away from the vertebrae, thus rotating the scapula upward slightly. Pectoralis minor, you'll find is deep to the pectoralis major. It's responsible for abduction, protraction, draw scapula forward and tends to tilt lower border away from ribs. Downward rotation, as it abducts, it draws scapula downward. Depression, when scapula is rotated upward, it assists in depression. Here it is right here. Subclavius, right below the clavicle. Stabilization and protection of the sternoclavicular joint. Right here is the manubrium/sternum. And here is the SC joint. Right here, sternum and clavicle. Aids in depression and abduction away from the body. Scapular abduction. Scapula move laterally away from spinous process without rotation. Example, push up and bench press. They're the agonists. Pectoralis minor. Serratus anterior and the serratus anterior. Both of these aid with push-ups and bench press. Scapula adduction. So the return from abduction occurs with retraction. The agonists are the middle trapezius and the lower trapezius. This is the middle, and here's the lower. This is what pulls the arm back, and the rhomboids as well. Scapular upward rotation. Lateral and upward movement. The agonists are the middle trapezius, the lower trapezius, and the serratus anterior. Here's the middle trapezius, the lower trapezius, and then here the serratus anterior on the anterior aspect of the body. Scapular downward rotation. It's a downward and medial movement from the glenoid fossa is rotated downward or when downward movement of shoulder joint occurs. Example, lat pulls, pulling weight down. The agonists are the pectoralis minor, pulling down, the rhomboid, and the scapular elevation, lifting scapula without rotation in anatomic position. Shoulder shrug. The agonists are the levator scapulae, the upper trapezius and the middle trapezius. Here they are. Also the rhomboid. Scapular depression. Example, a dip. The agonists are the lower trapezius, pectoralis minor. And just here are some websites for further research on the upper shoulder and the shoulder girdle. Includes that.
Hi.
Oh, hey.
Okay, what are you doing?
Hold on.
Okay.
I was working on this thing.
Are you still visiting?
Yeah, I'm trying to find where I put it. Maybe it's still going. It's like a Screencastify. I don't know.